Because when we stimulate cell growth or cell function is warming. You know, physical therapists have been using lasers to treat tendon and ligament injuries for a decade now. But they're very low-level light therapy type lasers. They're small diodes that penetrate tissue without burning it, and they just kind of heat up. And when you have heat in a tissue, you bring cells to it, and you speed up the healing process. That seal blood vessels, lymphatics, and what have you. January 13th, I had an acute appendicitis, had my appendix out, and they did a laparoscopy, and I asked him afterwards, this young surgeon about the age of my son, I asked him if I dulled the scalpel with my well-developed abdominal muscles. And after he got off the floor and stopped laughing, he said they used the laser to make the incisions. And I said, oh, really? So we got a little discussion about it. I walked out of there 10 hours after the surgery, went home, and the only thing I had to wear sweatpants for the next 10 days because my belly I looked like I was pregnant. And at any rate, those laser incisions they were great. It never bothered me at all. He's a pompous SOB. Now what the hell is that? I'm having visions of all these problems and lawsuits and other than that, and if there's not a lot of bleeding and there's very little discomfort and there's no swelling, sure, you're going to have better patient acceptance. To me, it's just common sense. And you will have decreased swelling and edema because of the sealing of the vascular tree. There is decreased pain, as I've mentioned several times. Now, reduction in bacteremia. That's probably true because you're killing bacteria as you cut, surface bacteria. I mean, if they're in the way of the bean, they're going to vaporize along with the tissue. You're sealing blood vessels, so there's probably less likelihood that you're going to induce a bacteremia. We do not sterilize a pocket. We have never sterilized a pocket, and I doubt that we will ever be able to sterilize a pocket. And for a laser manufacturer to look you in the eye and say, well, you're sterilizing a pocket, they're just full of it as a Christmas turkey. Because it doesn't happen. And I will show you the evidence for that until it's ad nauseum. Now, where the hell is he getting that? Less pain, less trauma. I'll buy that, but less healing time? What the hell's he been reading? Comic books? It does not heal faster. Believe me, it just doesn't. I don't care what he says in his damned article. It doesn't heal faster, and he's got no evidence to say that it does. That is pure hyperbole. What about lasers on root surfaces? We're going to switch gears a little bit. We didn't talk about soft tissue a lot. I did a study way back in 1992. Tom McCauley's a periodontist down in Florida who had, at that time, more money than he did brains, I think. Oh, that's nasty. I shouldn't say that. He just had more money and knew what to do with. Tom calls Bill and says, look, I got a bunch of patients there. We've treated with a laser, but I'm not sure it's doing any good. We'd kind of like to look at them. Can you if we treat some teeth that are going to be extracted anyway, can you look at them under the microscope? So Bill volunteered me to look at them under the scanning scope. And as a result of that, I ended up writing a paper based on that. It was kind of interesting. This is the root surface of a tooth treated by the hygienist with an ND-YAG laser using these settings, 12 joules per centimeter squared. Now, the Millennium people frequently take me to task for this because they say that energy density is well above what they recommend, and it is. It's like 12 times above what they recommend. But in 1992, that was the laser manufacturer's recommendation. And that's why it was used that way. Now, that brings up a problem. It's slowing down now, but there for a while in the mid-90s and early 2000s, the target was constantly changing because we were doing all kinds of uncontrolled human research in private offices, and people were getting adverse results, and they would tell the manufacturer, and so they kept adjusting the laser settings. And they're getting down now to where they're pretty close to where they're not inducing a lot of damage. But it wasn't always that way. So in 1992, actually, I think Tom did this in 91, you look at this cavitational defect here, and you look at the wall of it, and it's melted. That's melted root surface. That's the HA in there that's melted. And if you look very closely at it down here, it's very porous, isn't it? Field. Well, we got taken to task by Millennium on that, too. They said, well, how are you doing this out of the mouth? And you're holding that laser tip perpendicular to the surface. No wonder it's doing all these things. And this is what it looks like the way we did it. And so we went back, Dan Thomas, I said, Dan, I'm not taking this crap from these guys. Go back and do it, but hold that laser tip parallel to the damn root surface. Do what they want. We'll just use the same laser settings, see what happens. So Dan did. Well, this time we decided we'd grow fibroblasts on it. Since we were doing it out of the mouth anyway, we used sterile root surfaces, we treated them, and then we put them in cell culture to see if the fibroblasts would attach to the surface. Well, this is a control. That's how it should look. This is a control. And this is a char layer of little bomb craters. And look what the fibroblasts are doing here. They grow right up to that char layer and stop. They will not cross over it. In fact, they curl up to keep from touching it. And that's laying that laser tip on a flat surface like you would in the mouth. Well, they didn't like that either. They're hard guys to satisfy. And we went to the extent of counting the number of fibroblasts attached to a control chip of tooth root per unit area, and then we counted the same number on a lased surface. You can see it's appreciably less. And then we did scaling and root planing of that surface, and we got more attachment, and then we prophy jetted it and almost got it back to normal. Prophy jet. So whatever's causing the fibroblast not to want to attach is a surface phenomenon. It isn't penetrating to any extent. You know, I admit freely that at the energy densities that the manufacturers suggest you use now, this is not likely to happen. But you know, there are idiots in every crowd. And I say that cynically because somebody's going to get that laser in their hand. It's like when the handpieces first came out. We burned up a lot of teeth playing with them. Because I remember I couldn't cut a crown prep when I was in dental school until I'd done 20 crowns with a belt-driven handpiece. And then they would let me use the high-speed handpiece. And the first time I used it, damn near bisected a tooth. Because I was used to really bearing down on it from that old belt-driven handpiece. Any of these instruments are dangerous in the hands of the wrong person. And somebody's going